Everyone, it's Lisa from The Fulfilled Pharmacist, and what I wanted to talk to you about today is something that's really important because it's becoming more and more common for women, recurrent urinary tract infections. So basically, I've been a pharmacist for 31 years. Probably every single shift I have ever worked as a pharmacist, I have filled at least one prescription for a urinary tract infection. And at least 50% of all women will get at least one UTI once in their lifetime. So in the past, it was something, fairly easy to treat just because of a woman's anatomy and different hygiene issues. Urinary tract infections are more common in women. As we get older, sometimes they become more common in men as men start having more prostate issues. But for women, they're somewhat commonplace, and I'm sure all of you may have had one or have had a sister, mother, friend who've had urinary tract infections. What's happening now, and there was just recently a big article in the New York Times about this, that urinary tract infections are becoming very, very, very resistant. So many women are not so easily able to treat their urinary tract infection, and it's becoming back and becoming more recurrent. So what I wanted to talk a little bit about today is preventing urinary tract infections, especially for those who are susceptible. So what is happening basically is that E. coli are the bacteria that mostly cause urinary tract infections, and they're becoming resistant to the gold standard drugs that have been used in the past. So other drugs have to be used. So the first tip I have is to help not feed those E. coli. So they really feed off of sugar. So if you are prone to urinary tract infections, I would reduce the sugar in your diet. So basically what I always aim for is 25 grams of sugar per day, which is the American Heart Association recommendation for women, and it's 36 grams per day for men. But just start reading labels. There's sugar in everything. So you want to start reducing that sugar level so that bacteria don't have something to feed on. Just as an aside, because I've talked to so many women who have a painful bladder, I have talked to women in the past who have a very high amount of fruit in their diet. And so even though that's a natural sugar, I would really start working on maybe reducing sugar, modifying how much sugar you eat, eating more vegetables, especially if you're having a vegan or vegetarian diet and you are prone to urinary tract infections. So not necessarily for something for all women to worry about, but if you are currently having a lot of UTIs and eating a diet very high in fruits, fruits that are high in sugar like bananas, dried fruits, things like that, you may want to take a look at just reducing those for a little bit just to see if that doesn't help. So the second thing I want to talk about is taking a probiotic, and I'm all about a probiotic, and many of you have heard me talk about this in the past. There are some studies that show that especially probiotics that contain lactobacillus may be helpful in reducing urinary tract infections. But the reason I really like probiotics is because they're also boosting your immune system through your gut health. So anyone who's prone to having recurrent infections, you're getting that boost from having that good gut flora in your gut, and also helps boost your mood. So sometimes when you're going through these issues, your mood can become frustrated and depressed, and that good gut flora will help boost your mood as well. The third thing I want to talk about is D-mannose. And so this is the D-mannose that I take. It's by West Coast Mint. And I just love it so much. That's why I share so much about it. But I wanted to talk a little bit about D-mannose. And so one of the things that D-mannose is in different fruits. So that's why they always tell you to drink cranberry juice when you have a urinary tract infection, because cranberries are high in D-mannose. So instead of drinking cranberry juice, especially because you have to drink the one that is not sweetened, it's just really easy to have this. And I want to show you the scooper because it is just super, super small. I don't know if you can see it. It's like probably almost the size of my pinky nail. Just a tiny amount of D-mannose a day. You can take this 1 to 3 times per day. And I do have a code if you wanted to try this West Coast Mint D-mannose, FP Fulfilled Pharmacist FP15 if you do want to try that. And I just really recommend it because it's just so easily dissolvable. It's easy to take. I just put it like in this little, I wouldn't say it's even a shot glass. It's from a little medicine cup. And I just put it in there once a day, but you can take it up to 3 times per day. For overall bladder health, they do suggest using vitamin C as well. I don't recommend this for women who have a painful bladder or going through a bladder infection at the time, because vitamin C can and other citric products can really irritate the bladder, and especially for women who have interstitial cystitis, vitamin C is not recommended. But these other things can easily be incorporated into your day if you have recurrent UTIs or are susceptible to them, or have an interstitial cystitis or painful bladder syndrome diagnosis. So they are, again, to look at sugar levels, to have probiotics, and also to have the D-mannose. I did also want to add, in this article, there were studies that were done showing that a lot of E. coli is in poultry and chicken. And so this is not an anti-chicken video, but just be very careful with the handling of chicken. Make sure that you're cooking it well and that type of thing, so that you don't get E. coli in your gut. They've now found that 12 strains of E. coli that are found in chicken can also be found in urinary tract infections. So just be careful with the handling of your chicken and all your food in general to prevent any E. coli from building up in your system. The probiotic will actually help build up that good bacteria for that. But I hope these tips are helpful for you. I also do want to note that there is a resource in my, if you click the link in my bio, for a free guide, 5 tips to ditch bladder pain. So a lot of these tips are aimed towards women with interstitial cystitis, but all of the foods that are recommended in there to help reduce bladder pain are also suggested if you are experiencing a urinary tract infection. So you want to reduce those acidic foods, acidy foods, spicy foods. So you can click the link for that resource as well. So hopefully these tips are helpful for you. I am happy to answer any questions as well, and I hope you guys have a great day.